station that is enclosed, just in case there is a lid that comes loose. So this is the most advanced.
Hello.
The most. Dr. Maggie, this is Peng, who is one of our laboratorians. Peng, would you?
Cool, thank you. Let's see what's going on with that.
Oh, no, I turned it off.
You know what? Let me leave because it's a little more sensitive than I was. Just knock me out of the way, you know that. Bless you.
Workforce development. Everything that you see here is built in the U.S., most of it here in Wisconsin. And so the idea here is now that you have a patient sample in the tube, you need to spin it down to get the liquid on the top. The liquid is where the tumor DNA is floating around. That's what this is. Now you need to bind that liquid to tiny magnetic particles. So the magnetic particle has a little strand of DNA, and it pairs with the strand of cancer DNA and binds, and you have that attached to a magnetic particle. And here, these are little magnets. They turn on, pull that cancer DNA and the particle to the side. You take out the liquid, put in fresh liquid, and you use that now in this instrument to set up a very special reaction, which is the science developed at Exact Sciences that targets very unique changes in DNA that we discovered with the Mayo Clinic. If those markers happen to be present in a sample, it's time for a colonoscopy. And this is this very special machine called the PCR machine. And this is where the testing actually occurs. And the results get uploaded to the cloud and get reported back to the patient and their physician. And so it is 5 years of intensive research and development went into developing this. And now we are using it for many other types of cancers, esophageal cancer, endometrial cancer, liver cancer, and with the same technology platform. And we can only do it with incredible people like Megan.
Hi, Megan.
And Senator Baldwin. And Mayor Rhodes Tomlin.
Megan, it's a pleasure.
Hello. It's such an honor to meet all of you, and I am so excited to be here representing our technical laboratory. My name is Megan Graychek. I am a clinical laboratory scientist here, and I have been working for Exact Sciences for 3 years now. I graduated college in May of 2020 here at UW-Madison, and in November of 2020, I started my work here, and boy, what a time to join healthcare.
True.
So my personal journey here at Exact Sciences has been incredible, and I have been able to kind of help myself because both of my grandfathers were diagnosed with colon cancer, and both of them were able to recover. And so I feel like it has really helped me to then want to help other people have that kind of success story and, you know, let them feel that excitement and joy of being able to come out of cancer. If there's any questions I can answer for you, I'm happy to.
Maybe, Anna, if you could talk about the team of people that make all of this possible.
Yeah, no, that's incredible. Megan's story is not alone, and her passion is not alone either. Megan shares that passion with this whole village at Exact Sciences, who are all in some shape or form connected to cancer, because we're all connected to cancer, and they're all incredibly dedicated to make this possible. These laboratories, as Kevin said earlier, we have about 1,000 people in Wisconsin working in laboratories for colorectal cancer screening or cancer screening in general as we develop new tests. And we have a lot of technologies that have come through the pipeline through working in partnership with collaborations with Madison Area Technical College and other partnerships. We concentrate in working with different players in the city, including the Urban League. We have worked with them very closely to bring opportunities to different employees in the city that they wouldn't have otherwise, and make sure that they have good wages, good opportunities, and abilities to grow their careers and be with us for long term to come. And as you can imagine, it just takes a lot of people to run these operations.
Sure. Yeah. Dr. Biden, I know you care a lot about education and workforce development, and so I just want to highlight one of the things that Anna said, which is that obviously we have a Badger here who came from UW-Madison, now working at Exact. We love to see that. But they also have built a partnership with our local Urban League, where Urban League will reach out to folks, put them through a fairly intensive workforce development program, and then Exact
and they have become incredible team members.
Yeah.
And it really speaks to the fact, as Anna always says, it takes a village. We have teams of people here that come from the community, that come from our universities, that are robotic engineers, electrical engineers, mechanical engineers, scientists, laboratorians. I think Anna's story is incredible because she came from Puerto Rico to Kansas to Utah and became one of the preeminent laboratorians in the country, and now is chief laboratory officer of a company with 1,500 laboratorians.
Well, I did think when we walked in and I saw the robot, with taking the boxes, and I thought, I've seen so many of those programs, through workforce development. So, I mean, it really did hit my head, like, this is great.
And it's wonderful for our city too, of course, because they're bringing really high-quality jobs with the possibility of advancement, and getting a really diverse workforce in at the front line. And it's a wonderful thing for the science, but also for the people that are here.
Yeah.
And Senator Baldwin has been so incredibly helpful in so many ways. We've gone from completed a 27,000 patient clinical trial we call Cologuard 2.0. And the level of detection increased to 94% of cancers in the population, and the false positive rate of the new test dropped 30%. So it is over 90% sensitive and 90% specific. We submit that to the FDA at the end of the year. We're so excited to bring that to physicians and the patients who need to get tested.
So you were saying that the
Can you hear? Should we move closer?
I'll move closer.
I mean, because this information should get out to the general public.
You were saying with the multi-cancer screening, so you're developing a new test for that, and that some of the early studies have shown that you can detect through a blood test multiple types of cancer, right?
Yes, there's early data that suggests that. There's a lot of work still to do in a major clinical trial, and it uses the same technology that this Cologuard 2.0 that I mentioned showed 94% cancer detection. So improved cancer detection over the current version and a lower false positive rate. It is a huge step up, and we want to make sure that we get all people 45 to 85 average risk screened. It's simple, it's at home, and in the future, we're going to be able to screen for individual organs and also a whole person. And it's the same science. And it's the, I think it's the national investment in science that occurs. Much of what became Cologuard came from the Human Genome Project, which was funded 25 years ago. We wouldn't be standing here today. And so we just really appreciate the White House's focus on the cancer moonshot. It has energized our whole field, and it's something that we deeply believe in and want to be a part of.
Well, yeah, we do too. That's why we reignited the Cancer Moonshot.
Absolutely. I wanted to thank you for being such a critical part of the Tech Hub application. So CHIPS and Science Act passed is going to allow regional Tech Hub designations. Our proposal in Wisconsin is a personalized medicine proposal, and Exact Sciences has been a big leader in the consortium that's put that application together. So thank you.
It is our pleasure. We deeply believe in science in Wisconsin. And when you look around, the automation is also comes from Wisconsin. The engineering, the mechanical engineering, the electrical engineering, all of that. It's a Wisconsin company. Cologuard was born here, and we'll export it all over the world too. So that a science hub becomes a global exporter of American know-how and American technology.
All the while creating American jobs.
That's what we're all about, right?
That's right.
Yeah. our government, nonprofits, and businesses. And all of you are joining together to work to make this possible. And Lisa, I want to thank you for hosting us today. And what is happening here at the Foundation for Black Women's Wellness is an example of the collaboration we need. And Tammy and I, we just came from the Exact Science Laboratory, which is pretty incredible. I mean, to see all that, you see the, color guard on the TV, but you don't really think of all that's involved, And then you go to that factory and you see all the steps and the machinery and the people. And I mean, what a wonderful thing to be able, to detect cancer earlier and get more people screened for colon cancer. Mm-hmm. So I want to thank all of you for taking the time to be here, to share your stories and your expertise, because, cancer has the power to change us. We know that. But we have power too.
Absolutely.
Yep. And for Joe and for me, this is the mission of our lives. So together and through the Cancer Moonshot, I hope that we can end cancer as we know it. So thank you. Thank you all. Tammy, thank you. Thank you.
Dr. Biden, you inspire us to keep on with our work. And as you said, everybody is touched by cancer. Mm-hmm. I can think of family members. I lost my grandfather to cancer. And so I just wanted to very quickly mention some of the initiatives at the federal level that working hand in hand with President Biden and the Cancer Moonshot, that even in very difficult and challenging budget times, we want to increase and are proposing to increase the research budget at NIH. For cancer research, one of the few areas where we've been able to increase. I'm leading the effort to reauthorize the National Breast and Cervical Cancer Early Detection Program.
Yes.
Through the Screens Act. And not only to reauthorize it, but to see it grow so it can reach more people. This is an incredible program for folks who don't necessarily have access to early detection and screening, and we call it the Screens Act, that we need to push forward. I also want to say, we last year had a huge breakthrough under Joe Biden's leadership of finally making sure that Medicare would stand up to the big pharmaceutical companies and negotiate for lower prices. Right. Yeah. And just this week, they announced the first number of medications that are going, and one of them is a blood cancer drug that many people rely on, but its affordability is in question. To end cancer as we know it, we need early detection. We know that later stage cancers are harder to treat, and we need to address disparities in healthcare head on. And that means that we have to do greater outreach, greater education with communities of color and others who have limited access. And that's why we are here at the foundation and here with this amazing group of people who've taken their own initiative. And I want to hear, and I know Dr. Biden wants to hear from you.
Yes.
So, take it away.
All right. Well, I am overwhelmed by you both being here today, Dr. Biden, Senator Baldwin, Carol Johnson. My name is Lisa Payton Kerr. We said this in a lobby, founder, CEO, and president of the Foundation for Black Women's Wellness. I was touched by what you said, personal stories. Our organization is the outgrowth of personal loss of family members. My mother, aunts, uncles, and several of those deaths were from cancer. And so we are in one accord in understanding how we turn purpose, pain and loss into purpose and results. So we're grateful to have you here today. We exist to empower a generation of well Black women. We've been doing this work for 11 years, and a big part of that work, as you said, Senator, is eliminating health disparities that disproportionately impact Black women and families and communities. And cancer is one of those greatest threats. We have health system partners in the audience that we partner with, and they know that cancer is the leading cause of death here in Dane County where we sit. And it's the second leading cause of death in Wisconsin for all Wisconsinites, not just Black women, not just communities of color, but for everyone. But we know, as you spoke about those disparities, that African Americans are the least likely to be diagnosed for cancer, but the most likely to die, and at younger ages and at greater rates. And we talk about this and work about this and other disparities in our state. And it's a grave one that has been impacting our community for many, many decades. So this moonshot, the president's initiative, is so important to Wisconsin as well as to the nation, because we feel those casualties, but we also have survivors in our audience. We have survivors in our audience who are living proof that when we provide the proper care and the services that the president is providing, that we can make a powerful difference. So what we do at the foundation is really to support first education and awareness building for prevention, early detection, and screening. We've got partners around us right now, like the Wisconsin Well Women Program, who are partners in that. We provide assistance for screening and care. We help folks get plugged into insurance if they're uninsured or underinsured to access proper care, and support the healthcare navigation and the advocacy so that they have voice when they're talking to their clinicians and get the proper care they need. And of course, support groups for survivors, which you'll hear about in a second. So we're proud to be able to be a leader in this work, and to know that our nation's leader is in this with us and moving so powerfully to end cancer.
Thanks, Lisa.
So
Thank you.
Thank you.
Thanks.
Thank you. Christine Russell, I would love to hear your story.
Absolutely. So first of all, thank you, Lisa. Thank you, Dr. Biden. Thank you, Senator Baldwin. We are really honored to have you in our home away from home. And as Lisa often says, there is power in sharing our stories, and it really demystifies that C word, and it gives the thriver their power back. I was diagnosed with large B-cell lymphoma in July of 2018, and I had a pain in my left rib, similarly to what I'm experiencing now. That was associated, I'm thinking, of an overuse injury, or I was nursing at the time. And I'm no longer nursing, but I'm justifying it again. And I realized when my son was 8 months old, he's now 5, that he favored my right breast when nursing. And as we know, breastfeeding is known to minimize the risk of breast cancer, which was why it was so important, and my doula told me so, to breastfeed. But the next day, the pain really became excruciating, and I went to urgent care at Union Corners here in Madison, the clinic that I literally just left today. And when they took x-rays, the technician thought my lung had collapsed. But a rush to the ER and several hours and finally several screenings later, it turned out to be a large tumor the size of my lung. Wow. And that was the journey ahead of us. And I say us because cancer is not a we journey. It is an us journey. Yeah. And so if you do not have an us or a we, give us a call, and we will be happy to connect you with a lot of the programs that we have here at the foundation. So after 15 years of corporate America, my cancer journey really opened my mind and my heart and my spirit to a new career path in community wellness right here at the foundation. Lisa took a chance on me, and I appreciate you, girl. I had the honor of meeting one of the most vibrant thrivers and ambassador, Miss LaShonda Prescott Manley, who's sitting in the office. Yes, you girl. And because of her, and because of her passion, and because of her purpose, we created the Cancer Thriver Circle here at the foundation just last year in July of 2022. It is a sacred place for Black women and men to come together unapologetically and share their challenges, their success stories, and learn from one another, and also the top educators in cancer and the well-being space. We bolster our monthly gatherings with regular strolls at a local park that LaShonda leads. We have meetups at Dane Dances and Cosa Spa. And LaShonda always says we need a space to just have fun and experience joy. And we will do just that at our first annual Wear Pink Day event right here in October as we uplift breast cancer thrivers, honor survivors, and encourage proactive steps in the fight against breast cancer.
Oh, thank you.
Thank you.
So Gail Johnson, can you share some of your work with the Wisconsin Well Woman program?
Yes. So first of all, good afternoon, Dr. Biden. And again, Senator Baldwin, it is great to see you again. The Wisconsin Well Woman program is our state's component of CDC's National Breast and Cervical Cancer Early Detection Program. And here in Wisconsin, we've been providing breast and cervical cancer screening and diagnostic, and I also like to say education, since 1994. And in that time, we have provided breast and cervical cancer screening services to more than 83,000 Wisconsin women. And keep in mind, in Wisconsin, that means that we have touched women in all 72 counties. We also have a very close working relationship with the 11 tribal nations here in Wisconsin. Now, we don't do this alone. We have a network of over 40 provider organizations. That includes health systems, rural health clinics, outpatient health clinics, and federally qualified health centers. We also rely heavily on our local health departments because they actually coordinate the program at the local level. We also have wonderful community partners. And when I say community partners, one of the things that I like telling people is the folks who call me and say, so-and-so told me to call you. And they will be calling from a faith-based organization or a small neighborhood organization. And they call to say, so-and-so told me to call you because we want to put on a program, or we want to do this. And, you know, either we want you to come or someone who's on your team, or, you know, we just want maybe some resources to help us to get the program going and get it off the ground, okay? And also we work with, obviously, we have the academic partners. We also have a patient navigation component. We have 3 patient navigation sites in Wisconsin that are a part of our program. So we have one focusing on women living in rural communities. We have one in Milwaukee, obviously focusing on the largest city in our state. And we have a patient navigation component right here at the great UW Breast Center. So we, you know, our thing is we love working with communities. And I always tell our team, we always err on the side of the woman. And that means we're going to try to do everything we can to help you get what you need. Because remember, the women that we're working with, for the most part, have no insurance. Or if they have insurance, it doesn't necessarily cover everything. Most of the women, when we look at incomes, we're talking about women with incomes at or below 250% of the federal poverty guidelines. So we want to do all that we can. If we can't do it, we try to find someone who can. And when we look at, especially breast and cervical cancers, one of the things that is important, and Lisa touched on this a bit, is trying to eliminate those barriers that people have to getting what they need. That is very, very important to us. We've been working with the Foundation for Black Women's Wellness since the beginning, right? Okay. Love working with them, and you know, I tell people the work is important, and you know, we're going to just keep doing what we do. And Senator Baldwin, wonderful to hear about the reauthorization. I remember the last time around, so we're going to keep our fingers crossed and everything else, that everything works out.
Dr. Patricia Teles-Guerin, will you tell us about your work, please?
Thank you for the invitation. It's really an honor to have been invited to be with Dr. Biden, with you. We have worked together before, and we all work together anyway. I'm Patricia Teles-Guerin. I'm a physician with Access Community Health Centers, and I'm also an associate professor with the Department of Family Medicine and Community Health with the School of Medicine and Public Health, a long title. And I think more importantly for me, I'm the co-chair of the Latino Health Council in Dane County with my wonderful co-chair that should be sitting here, Shiva Vidarsila, right here. We call her the fairy because she makes things happen. So, here in Dane County for the past 30 years, we have been in existence with the Latino Health Council for the past 30 years. And actually, we started with the American Cancer Society that they wanted to make sure that they will reach out to the Latinx community to be able to provide, preventive services and others. And at that time, our community here in Madison was very small, but we had this vision that the community was going to start growing really rapidly, which is exactly what we have seen over the past 30 years. So we decided to form the Latino Health Council, and together with a coalition of other Latino serving organizations, we're very, very well organized with, within our community, and we all support each other for any of the activities that we do. We have been providing language and culture appropriate health education, particularly with cancer is one that is really dear to our heart. As you said, we all have a family member that, has been touched by cancer. We are also advocates. We never end advocating for services for our communities. And now we are also offering mentorship to the next generation because we know that we need more people that look like us, that speaks the language to be able to provide for our communities. That is so very important. We think that our strength of what has made all this happen is the trust that we have been able to establish with our community, which is extremely amazing and important for our communities of color. So it has been really a long journey, but we love what we are doing. Regarding cancer, obviously, we have a lot of disparities, and the rate of cervical and breast cancer early diagnosis is very low in the Latinx community. And for that, many patients present with a later diagnosis that is even harder to treat. So we know that there are several factors that could influence this. Obviously, knowing more, so educating, and that's why we have been doing a lot of education. Also, having people from our own communities reach out to people that look like them. So we have done a lot on promotoras, so health promoters from our own community. For the Well Women program, actually, the Spanish part of the Well Women program started out of my home. We provide our home number, and people will call our home and register with my mother for the program, because at that time, 25 years ago or so, we did not have a bilingual program that now we are so thankful to have. So we were very happy to just give out the number, and our number is now everywhere in the community. If you need anything, you just call us at home, and my mom can provide with the information and counseling and everything. It was even more important, your story is so touching. My sister was diagnosed with endometrial cancer. She's one of our main leaders in the community, and when that happened, it really touched all of our community, and we had to come together to support her, and we had a great support from the community. So that was amazing. So here in Dane County, we have been able, as you are hearing, to partner with great organizations that are providing services. However, many times we are told that some of our community members who happen to be here without formal documentation do not qualify for services. We really believe that humans are humans, regardless of their documentation status, and that everyone deserves equal care. So I was very happy to hear some of the initiatives that you're working on, but really wanted to emphasize that part.
Yes.
Access Community Health Centers, and I want to call out Dr. Lovin, that is sitting right there, our CEO, has been an amazing partner with our community to provide services to the ones that are most in need. And then also the UW Health System, because they really provide amazing care for our cancer patients, regardless of documentation status, which is very unique, I think, in the country to be able to do that. But we still need more, right? Because that is not enough. And we would love to be able to provide access to preventive services for all members of my community, right? These members who contribute daily to the economic and social power of this amazing country. So we are so glad that you are here listening to us, because we know that women make a difference on what the men are doing. We know that, right? So we are really hoping that tonight when you talk to your husband, you say, I was in this wonderful group of people from Madison, Wisconsin, of all places. I would really need to work on that immigration and getting care for everyone, right? Because we all have the rights. And COVID showed that whatever happens to one population is going to happen to everyone. So when we have people from our communities that has cancer, it's going to influence everyone. So thank you so much for coming and for listening.
Gee, you're going to be my closer, but next I want to hear from Carol Johnson, the administrator of HRSA. So glad to have you here.
Thank you so much, Senator. Thank you to the First Lady, and thank you, Senator Baldwin, for your leadership. Thank you to Lisa and your incredible staff and board who make this place happen, who create a safe space for women who need it. It is my great privilege to run the Health Resources and Services Administration. We're part of the Federal Department of Health and Human Services. We fund and support community health centers and rural health clinics, and we help build the health workforce for communities that are historically underserved. And so it has been amazing to me. I had the honor of working with the then Vice President on the Moonshot when it was first launched. And so to have the opportunity to serve the President in this role at a time when the First Lady and the President have said the scientific research is critical, and we need to double down on it, but we have to be doing the work in communities to make sure that every community is getting the benefit of the research. And that is why the First Lady has worked so hard to help us get the support we need to really help community health centers do more work around cancer screening. We talked about navigators and promontorists. What that means is you have an advocate. There is someone by your side when you go through the screening process, speaks your language, is your advocate to make sure you get those follow-up treatment, get connected to services. And with Senator Baldwin's leadership on making sure that CDC has the resources it needs, making sure we at HRSA have the resources we need to do this critical work. It's really been, it's an honor for me to do this work. It's so exciting for me to be here with you to hear exactly how it's all being implemented. And there is no greater advocate for the communities that need these resources than Senator Baldwin, who is constantly making sure that she's fighting for everyone here in this room in Washington.
G. Smith.
Well,
welcome.
Thank you. Thanks for having me. This is such a blessing to hear all the work that you guys are doing, and that's what it's going to take, to really attack this cancer. And first, I want to welcome you, First Lady Biden. So sorry to hear about your loss when I found out about your son. So I can only imagine how it is to lose a child. And Senator Baldwin, thanks for all you do. Well, I am Garland Smith. Most people know me as G. I'm the owner of G's Clippers Barbershop Beauty Salon in the city of Milwaukee. Just recently celebrated 28 years in business. Thank you. It's a 30-chair operation, so it's the largest barbershop in the state of Wisconsin, one of the largest in the Midwest. And I am one of the first barbershops in the country to have a full health clinic in the barbershop. And in that clinic, we provide blood pressures checks, blood glucose level checks. We're about to start doing prostate exams, colon guard for early detection, and we got a contraption that's coming in soon, an eye exam that can detect early diabetes. And it's powered by Freighter and Network Health. They've done an amazing job at seeing to it that we're doing all that we can do to address the health disparities in the urban community. I always say it's two businesses in the urban community that can truly change the trajectory of that community, one being the barbershop, the other being the church. You know, so I'm just trying to, just trying to do my part. You know, and some might ask, why did I, start, with the whole health initiatives? Well, my dad died at just 62 years old of colon cancer, one of the most preventable cancers out. You know, and he found out he had colon cancer and died 32 days later. So he was coping for some time. He was, we didn't know that for 2+ years he was giving himself laxatives to pass his stool, but one day that laxative didn't work. You know, so he had a major abdominal pain, went to the hospital, come to find out he had a major blockage, had to have immediate surgery, and he had advanced stage 4 cancer. So I would like to think if G's MKE Wellness Clinic, the clinic inside my barbershop, was around in 2005, 2006 when he was diagnosed, he would probably still be here. Because what we do is just try our best to let individuals know their numbers, get early screenings as well. Numbers as in blood pressure and such. But I'm just, here also to try to encourage as many barbershop owners, beauty salon owners as possible to get more involved in the community, in the community in terms of health. So it's been a great ride. I mean, I'm very excited as for what we've been able to do, and I'm so happy to hear of all of you guys and the work that you're doing in your respective communities, to bring that awareness and curb this horrible disease.
Yeah, it is. Wow. What a spectacular conversation. I have to thank all of you so much for participating and your commitment to ending cancer as we know it. Dr. Biden, thank you for your leadership and inspiration for all of us. Are there any closing words you'd like to offer before we wrap things up?
Well, I want to thank everybody for being here, of course, and telling your stories. I know it's not always easy, to talk about loss, but I think we can turn that around and talk about hope. And I think all of you offer hope. And I want to thank the press for being here because, the general public needs to hear this. They need to know that help is available, how important it is to get screened and early protection. It can make all the difference between life and death. And so I think, for me and for Joe, like I said, this is really the mission of our life. We won't give up. We're going to keep trying. And I know that all of you here feel the exact same way because cancer touches all of us. All of us. So thank you again for inviting me to be here. And, thank you for your heart in starting this and for, welcoming the community here. And you will make a difference. You all will make a difference in people's lives. And really, isn't that what it's all about? Thank you.
Thank you.
Well, can I come say hello?
That's great.
Sure, come on.
There you go.
And it's already a big part. Wisconsin's a big part of the game plan here.
Exactly. And I think we are seeing this right in here. Wisconsin is just such a huge state for the Electoral College for the general election next fall. So they're already trying to start that groundwork here in the Badger State with literally 3 visits in the last 3 weeks here.
Yeah, we're going to let Will catch his breath. We're going to try to catch the remarks of the First Lady as she addresses, like I said, about 500 people here. And it is school year, which really equates well for the First Lady, of course, a longtime educator herself. So it's no surprise that the White House wants to put her and team her up with education as the school year and the campaign season gets ready to roll. Charlotte, Mark?
It's the perfect fit indeed.
to be in a school with teachers and support personnel, and as I've heard, the greatest janitorial staff in the country. So let me see, are there, I'm not wearing my glasses. Are there any teachers in the house? How about paraprofessionals? And I saw some graduate workers that were in the house as well. This is the House of Education. And I think there's some governors and senators and mayors. So I wonder what's going on today. Seriously, as I walked around, I'm an AFT leader, and we represent a whole bunch of people in Wisconsin, including Mayor Rhodes Conway, who is a member of AFT Local 2231. Thank you, Mayor. But what I was thinking as I walked around is I have a picture on my phone from a poster that I have in my office. And it is a poster that I have carried around to every office I go to or have, that was given to me by an art teacher in New York City. I was the head of the New York City Teachers Union for a long time. I was the teacher of social studies in Brooklyn. And this is what this poster said and says, and what I thought about as I met a lot of you today. It says, teachers, I inspire, I encourage, I empower, I nurture, I activate, I motivate, I change the world. I am a teacher. And that is who all of you are. And that's who all of you are up here. And it is such an amazing thing to be in a school as we're getting into the first few days. And I don't know about all of you, I still have jitters the first few days of school. And seeing and feeling the energy that's in this room, the sense of hope and possibility. So, when others, create despair, we're dreamers. When others create fear, we hope. When others try to get us to be silent, we tell stories. When others smear us, we find solutions. And that's who you all are. And there's no better a person to greet all of you and all of us and to create that, in Yiddish it's called Nourishkeit, that sense of nurturing. Somebody in here who knows Yiddish. It's that sense of nurturing than Dr. Joe Biden. Now she's starting, by the way, on Tuesday as well. Because she still teaches. And what she's brought to the White House, and look, there's a person in the White House that accompanies her who's a pretty good guy too. But what she's brought is a sense of humanity, a sense of compassion, a sense of purpose, a sense of we're all in it together, a sense of connection and community. And it is so great that she is with all of us now as we, the profession that nurtures all other professions, gather this year to really fight loneliness and fight learning loss and really grow a generation of students to be the future of our country and our world. That is what you do. And I can't thank you enough for doing it each and every day. You know all the things you go through. I often have conversations with teachers about, okay, when do you do your lessons? Do you do it at 4 o'clock in the morning, or do you do it till 5 o'clock the night before? I used to do them all Sunday night to Sunday morning to Monday morning. You know what it means. So does she. You know who you are. I can't thank you enough for what you do. And another person who spends the time, she and I are on the road together a lot. I just said to her, where were you yesterday? She's like, I'm in Michigan. Where were you yesterday? I'm in Oregon. But Becky Pringle, the president of the NEA, I'm a social studies teacher, she's a science teacher. So she's the smarty pants, I'm the talker. Becky Pringle, I am so honored. I rarely get to introduce her. I am so honored that in this moment of time when the extremists ban books, try to stop us from teaching honest history, that I have someone side by side who actually fights this fight and lifts up all of us as she does. Thank you, Becky Pringle, President of the NEA.
I just want to say, Verona proud. Oh, thank you, Randy, so much. There is no one I'd rather be fighting this battle and leading into the future beside me, around me, all together, hand in hand, than Randy Weingartner. I am so proud to stand before you as the president of the 3 million member National Education Association. NEA, are you in the house? Here we are together, standing to not only promote, to not only protect, but to strengthen public education in this moment. I am so proud that I get to stand with our Wisconsin Education Association Council President, Miss Peggy Wirtz-Alton. Yeah. And the members of WEAC, yeah. As an educator for over 30 years, I know how much meaning and promise and hope this time of year brings. Hope as a verb compels us to act from a place of knowing and a place of believing, from a place of purpose and determination, from a place of strength and a place of power. Hope is what reminds us of our responsibility. It pushes and it pulls us. When we think we can't, we know we must. Hope is at the center of our humanity and our resilience, our highest aspirations. It drives us and it requires us to stand and to fight. That we lift up our voice in this moment is driven by that hope. It reminds us that we have, and that we can, and that we will. We will prevail. That's what we'll do. And we'll do it because of you. I have never been prouder to call myself a teacher than I am in this moment. When I greeted you and I asked you, how you feeling? You said, I'm ready. I'm excited. I'm waiting for the babies to come to our schoolhouse doors, because that's who we are. And we're not alone. With strong champions here in Wisconsin and all the way to the White House. We will not just stand. We will prevail. We have some unapologetic allies who understand that public education is the foundation of our democracy. And we will not stop until we reclaim public education as a common good and then transform it into something it was never designed to be. A racially and socially just and equitable system that prepares every student, everyone to succeed in this diverse and interdependent world. All of these allies around us, with us today, they always stand with educators and students and parents and families fighting for us on education and healthcare and labor, because as educators, we know we're educating the whole child, right? That whole student. All of us have that responsibility that when we say every, we actually mean every. So we have an incredible ally who has been the lead sponsor of the Equality Act, which offers protections to the LGBTQ plus community. Yes. In this moment where they need us the most. She is the chair of the all-important Education Funding Subcommittee. I need you to give it up for the fierce and fearless fighter, your favorite senator, Tammy Baldwin.
So good afternoon. It is so great to be here at Glacier Edge Elementary. And thank you, Becky, for that incredible introduction and for joining us here today. I know that both you and Randy go to bat every single day for our teachers, and that hard work does not go unnoticed. In the face of repeated attacks on organized labor in states like Wisconsin, AFT and NEA keep showing up to do the work on behalf of their membership, and so we deeply appreciate your joining us here today. Thank you. And to Dr. Biden, welcome back to Wisconsin. It's so great. I know in this room full of educators and support staff, both Dr. Biden and Governor Evers will feel right at home. And, right, they do. And to our educators and support staff, it's an honor to join you as we kick off another school year. Now, I know no amount of ice cream can cure the end of summer blues, but perhaps with our the new school year comes new challenges for every teacher. And right now, there's no denying that our educators face a lot of challenges. Over the last few decades, teachers and their voices have too often been sidelined or silenced, as educators have been the focus of misguided attacks. Our teachers are far too often being asked to do more with less, while trying to maintain high-quality education for every Wisconsin student, the education that they deserve. But despite these challenges, our teachers, all of you, show up every day for your students to help them learn, grow, and navigate what can be an increasingly confusing and chaotic world. You have not wavered in your commitment. You show up and you resolve to deliver for your kids and your communities. I hope you know you're not alone and that you have partners working to ensure that you have the resources you need to be successful, whether that's in the Wisconsin Governor's Mansion, on Capitol Hill, or in the White House. I am so proud to support public education and our teachers' unions and the educators and support staff who work day in and day out in service to their communities. As some of my colleagues in Congress continue to push for cuts to public education, I'm committed to fighting for the resources our students need to be successful, whether it be funding for career education, helping them feel safe at school, or support for school-based mental health services. I am also committed to supporting our educators with increased pay and benefits and a seat at the bargaining table and improved working conditions so that you can focus what's most important. You can focus on providing each and every child with the education they need to reach their full potential. So as we start a new school year, I want to thank you for your hard work and your dedication. I cannot stress enough how indebted Wisconsin is to all of you for your tireless work on behalf of our students. I, for one, feel lucky to work with one of the most pro-union, pro-education governors in Wisconsin history. So, our governor, who is fighting the good fight every day for Wisconsin teachers and students. It is an honor to introduce our next speaker, who is not only an advocate for our teachers, but knows firsthand how you're feeling as we approach the beginning of another school year. Please welcome Governor Tony Evers.
Thank you, everybody. Hello, Verona. It's good to be back. Please have a seat. Thanks so much. It's great to be back once again. Senator Baldwin, thank you for all your great work in supporting teachers and kids and others all across our state. And let's get you reelected. Excuse me. Went off script there, sorry. Also want to thank Superintendent Clardy and Principal Taylor and Glacier Ridge staff for hosting this event today. I had the honor of leading this district for 4 years. I don't know if any of you are still here. And having my kids have a first-class, world-class education, and that's a fact. I want to, excuse me. I also want to recognize all the folks from the American Federation of Teachers and the National Education Association, including obviously President Weingarten and President Pringle. Thank you for your good work that you do for the nation's children. Also, I'd like to thank all the leaders, educators, school staff, and more here today to welcome First Lady Dr. Jill Biden back to Wisconsin. Thank you for being here, Jill. Folks, it's no secret that I spent most of my career in education fighting for Wisconsin kids. As I say a lot of times, what's best for our kids is best for our state, and it is a truism. For me, as a teacher, then as a principal, superintendent of schools, and state superintendent, and governor, the back-to-school season is the best time of year for me. And everybody here that feels the same, I hope you know how grateful I am for the work that you do to go above and beyond for our kids, even as they walk through the front doors on the very first day. I also know firsthand that there is no limit to the length that teachers will go to help kids be their best selves, both in and out of the classroom, often acting not only as an educator, but as a needed friend, a counselor, an advocate. Each staff member plays an invaluable role in the lives of our kids, and frankly, in my book, you are heroes. And I just have to give you, for example, and I know this, I don't know if there's any folks that work in food service here, but I just have to have a shout out for you. Every school visit, every time I go to a school, I thank the people that do food service work here in the state of Wisconsin. You think about them, they see almost every kid, almost every day, every week, and for a full year. And if you're in a small enough school district that I was in just a couple weeks ago, or a couple days ago, they actually get to see them every day, every week, for 13 years. Think about that. You folks are saints, so thank you for all that good work. Obviously, as governor, part of my job is supporting you and your good work, and that includes making sure that you have the resources and support to be successful. And also, let me be clear, part of my work and our work together, frankly, also includes making sure people respect this important work that you do and that you receive the acknowledgement and appreciation that you deserve. With that, thank you for everything you do to support our kids and our state's future. Now, it is my pleasure to turn it over to an incredible educator, one of your fellow educators. I had the honor to visit his classroom last year. It was extraordinary. Great individual, one of our, as a state, 2022 Teachers of the Year, Cabby Hong. And I want to introduce at the same time our First Lady of the United States of America, par excellence teacher, Dr. Jill Biden. Folks, come on out.
Good afternoon, Verona. How's everyone doing? This is a totally normal Thursday, right? My name is Cabby Hong, and this is my 23rd year teaching in this incredible school district. I am a proud member of the Verona Area Education Association, WEAC, and NEA. It is my honor and pleasure to be introducing our very special guest today, First Lady Dr. Jill Biden. When I think about our First Lady, I think of someone who has the heart of a teacher. She is kind, compassionate, empathetic, but most importantly, she is a fierce advocate for all students. This advocacy comes from years of experience in the classroom. She started as an English teacher at St. Mark's High School, and today she continues to teach at Northern Virginia Community College. To see a fellow educator and English teacher like me in the White House is incredibly affirming. Personally, I'm thrilled to have the First Lady here because I know she believes, as passionately as we do, that all students deserve top-notch, safe, and welcoming public schools. No exceptions. Whether working to support America's strong public schools or inspiring the next generation of educators, we have a partner in the First Lady. So Verona, let's give a warm back-to-school welcome to our First Lady, Dr. Jill Biden.
Thank you. Thank you very much. Thank you. Thank you. Oh, thank you very much. Thank you. Thank you, please.
I hope my students welcome me like that on Tuesday. Anyway, thank you, Cabby. You know, your passion for your students shines through everything you do, so thank you. Thank you very much. And Principal Taylor and Glacier Edge for the warm welcome. So thank you all. Mayor Rhodes Conway and other elected leaders joining us, thank you for taking the time for asking me to be here today. And Becky and Randy, you always show up for your members. And we're all so thankful for your leadership and commitment to helping educators thrive across this country. And I'm truly honored to be here with all of you educators and support staff. You, all of you, make me proud to be a longtime member of the NEA and an honorary member of the AFT. With each new school year, we stand on the precipice of possibility. Hallways once again overflow with the roar of life. Shrieks of excitement shattering the summer calm, welcoming us to our next chapter. And as educators, it's hard not to wonder about the students we're about to meet. I mean, I've already looked at my roles. And so what will help their imaginations soar? What do they hope to become? And what will they push us to discover together? But for some, those moments have been ripped away. Last week on Maui, I spoke with teachers and administrators, counselors and librarians who had lost so much. Their loved ones, their homes, their schools, and their dreams for the new school years. But even amid their personal devastation, they were searching for a way forward for their students. You know, think about it. Think about all those lives lost. So many of those educators lost so many students. And as I've traveled the country again and again, I've seen educators' resilience in the face of impossible odds, flooding and fires, violence, and a pandemic. But then, that's who we are as educators, isn't it? I mean, we chose this path out of love for what we do and who we teach. And I think that that message matters more than ever. Because lately, when I turn on the TV, I see pundits attacking our public schools and saying that parents and educators are at odds. But that's not what I see. I visited schools where parents and educators are working hand in hand to help kids overcome challenges and make learning better for everyone. There's no divide between those who love our students and those who teach them, because we do both. This isn't just a job that we walk away from at 3:15. When we're caring for our own kids, we're thinking about someone else's kid too. To answer this call of service is in itself an act of hope. Because you all know this. This isn't just a job, it's a calling. And all of you were called to this profession for a reason. because you never give up on the families you serve, because you continue to believe that a better world is possible, and you make that world real, one student at a time. And none of that could happen without the support of our unions. I'm here to say that you aren't in this alone. You have a friend in the White House. Two, in fact. Me and my husband, Joe. I always knew that Joe would be an education president because this means so much to him. And he's delivered on his promises, from addressing the mental health and academic needs of our students to signing the bipartisan gun safety bill, to loan forgiveness for public servants. And here in Wisconsin, he is grateful for the incredible partners like Senator Baldwin and Governor Evers. Tomorrow or Tuesday, whenever you're starting, as you step back into your classrooms, I hope that you remember that right now, someone out there is standing a little taller because you helped her find the confidence she needed. Someone is working a little harder because you pushed him to try. Someone is braver because you helped her find her courage. We know that there are challenges ahead, but we do this work because it's who we are. We're optimists, we're true believers, we're union members. We stand together and we fight for the communities we care about. Have a great school year. Thank you. Thank you.
Get ready for an improved news experience. The all-new Channel 3000 News app is here. Tailored for your news the way you want it with a customizable home page. Stay informed effortlessly. Swipe through articles without returning to the home screen. And no more waiting. The new app loads faster than ever, ensuring you get news updates instantly. Download the all-new Channel 3000 News app today. Your gateway to news your way. Powered by News 3 Now.